everybody, and thank you for inviting me to this very important and timely event. I'm very excited today because I'm going to share with you for the very first time the results of our COVID study on exercise addiction, body image, and the use of image and performance enhancing drugs. I've been given only 10 minutes, so I'm going to share my screen. So let me start by giving you a brief introduction about the phenomenon that we are studying here. We live in an image-focused society where there is a strive for perfection. Individuals are constantly exposed to pressures about their looks, especially via social media. In a way, we move from the 17th century dictum, I think therefore I am, to I'm seen therefore I am. There is this constant need to be seen, to be acknowledged by others. We know that every day millions of texts and pictures are posted on social media, representing a visual representation of a fit of perfect body, which never exists. This phenomenon, also known as fispiration, a combination of the two words, fispiration is fitness and inspiration, has rapidly become a new trend, which we investigated in a recent literature review. And we well highlighted the large number of health concerns surrounded by these new trends. Fispiration often comes with mottos like the pain you feel today will be the strength that you feel tomorrow. Your body can stand almost anything, and many others that they invite very much the followers to push their physical abilities to their limits. This phenomenon represents a very fertile ground, not only for the objectification of the human body, but also for the development of a wide range of addiction and other related psychopathologies. We highlighted this in a very recent study we published last year in PLOS ONE, this work where we see for the very first time an association between exercise addiction, body dysmorphic disorder, and the use of iPads is what I'm going to call them from now on. It's a very long term to go through each time. We had a large cohort of 1,711 participants, and they were all exercisers. We've seen that 11.7% of them scored very high on the exercise addiction scale. And more alarmingly, 38.5% of them were at risk of body dysmorphic disorder, and 40% of them use a wide range of fitness enhancing products without consulting with a clinician in 95% of the cases. So when the COVID pandemic rapidly spread across the globe, we hypothesized that the engagement with certain rewarding behaviors, such as exercise, might have increased considerably as coping strategy during self-isolation when there was no access to gym. Although they might have helped to alleviate stress in difficult circumstances, we all know that exercise is good to your health. They might have also contributed to a reduced engagement in social interaction and other daily activities, and facilitated the development of long-lasting conditions, including new habits that are then difficult to break. So the aim of the study was to explore the association between exercise, self-image, and the use of image-enhancing drugs during this challenging time. Results were compared cross-culturally in the United Kingdom, Italy, Hungary, Portugal, Spain, Lithuania, and Japan. And this is our team. We really started small at the University of Hertfordshire, was the PI of this study. And rapidly, colleagues across 7 other countries decided to join us. Apologies for Brazil is still ongoing, so the results I will present today do not include the Brazilian sample. We decided to go for an online survey. Hey, there is no other way to study anything at this time where we can have contact with people. And we really much rely on the European network, the very large European network for the problematic use of the internet led by Professor Feinberg. And we posted adverts on fitness and wellness blogs, as well as other social media platforms. We were interested in measuring demographic, exercise addiction, body image perception with appearance anxiety inventory, self-compassion scale, and the use of iPads. The study was approved by the Ethics Committee at the University of Hertfordshire, and also by relevant bodies in the participating countries. Just before I present, I share with you a few slides with the first data, I would like to clarify some concepts. I talk about exercise addiction. Is there such a thing as exercise addiction? Well, exercise addiction is a behavioral addiction, is very similar to gambling, but it's not listed as a mental disorder in the DSM-5. Body dysmorphic disorder is a very severe disorder characterized by the distressing preoccupation with the perceived imperfection in one's physical appearance. And it often comes with time-consuming rituals like excessive mirror checking, aim at hiding or fixing certain flaws. Self-compassion, why? We were very much interested to know how compassionate were participants toward themselves such a challenging time. Were they more kind and understanding towards themselves or judgmental and critical? Also, the terms image and performance enhancing drugs, we've been studying them quite for a while, but the term might not familiar to some of you. They are also called lice drugs. It's like an umbrella term, which include anabolic steroids, drugs used for weight loss, sex drugs and aphrodisiacs, cognitive enhancers, and many others. But for the scope of this study, the term iPad will be used to indicate fitness enhancement drugs, including supplements. We identify a wide range of them advertised with misleading marketing strategy very often on the internet. In 2012, when we were able to discover over 700 novel psychoactive substances available for sale on the internet. We published the first handbook about the topic, and we work a lot with government and agencies such as the United Nations across the globe to improve the knowledge and the public health interventions in the field. So this is the first slide with the results that I would like to share. We had a quite large sample, 3,161 people replied to our adverts and were involved in the study. They were mainly in Italy and Spain. They were mainly female with a mean age of 35. And they were mainly occupied, so employed students. They were engaged in a wide range of sports. You see the list here, from running to walking to generic workout, a lot of martial artists, swimmers, but we also had 14.7% who didn't do any exercise. In terms of exercise addiction, it's interesting to see as 4.3% of the cohort actually score higher, score above the cutoff score, so were at risk of exercise addiction. And 15.2% were at risk of body dysmorphic disorder, with peaks, very high peaks in Italy, 81%, and Japan, 16.9%. We also look at the self-compassion, and 16.6% were poorly compassionate about themselves, especially in Italy and the United Kingdom. 29.2% made use of fitness supplements or iPads, with 6.4% starting a new use during the lockdown. And here we can see where the supplement users, they were mainly in Hungary, like is 57% of the sample actually said, yes, I'm using fitness supplements, you know, and Japan. Here we can see now the first logistic regression model that we developed. It's on fitness enhancement used according to gender. So as we can see here from the slides, the exercise addiction and the BDD, so those are risk of BDD, they were both key factors, influencing factors for the intake of supplements. So we can see a significance about these two values, but it's very minimal among the two genders if we split them, which is very different from what we found before in our study, the one that was published in PLOS ONE, where we've seen actually a very large difference between sexes, especially in terms of female for the BDD score. How about the behavioral change during self-isolation? 23.7% of them had a change in training during self-isolation. 46% felt they were smoking more during this period, and 13.4% used more alcohol as a coping strategy. And here is our second and final regression model that I'm going to share with you today, and it really looks at the prediction of change in supplement use, alcohol, smoking, and exercise. So let's have a look at the first model. The first model looks at the use of supplements among those who started the use of supplements for the first time during the lockdown. If you remember well, this was the 6.4% of our sample. What we can see here is the exercise addiction was a significant contributing factor to those using iPads, for those who used them for the first time during the lockdown. The second model was about change in exercise. Those who reported a change in exercise during the lockdown were influenced mainly by the low self-compassion and the exercise addiction, which were the main significant contributing factors to their behavior. But we didn't find any significant factors, any of these were significant factors in terms of enhanced smoking or alcohol intake. I hope you enjoyed that. My acknowledgement is very much a deep gratitude to all those who contributed to the study during this very challenging time for humanity. And the colleagues were mainly frontline clinicians and early career researchers undertaking research in this rapidly expanding area. So thank you to you all. Some of you are actually listening as I speak. And this is a small notice for all of you that the presented results are still unpublished, so please do not cite until the peer review process has been fully completed. So I'm going to go back, revert to the screen just to say goodbye and thank you for your attention.